Hi, I'm Doug Dormer. Today I want to talk to you about the revolution in consumer-facing health information technology and the challenges of funding these innovative projects in this summer of 2025. I teach students who are earning their master's degrees in health information technology or health informatics at Indiana University in Indianapolis. For the last 3 years, in the spring semester, I teach a class on consumer health informatics, or CHI, the role that technology can play to engage and empower patients and caregivers in this changing healthcare landscape. Each year, the class's big project, I find an open grant program offered by the federal government called a Funding Opportunity Announcement, or FOA. These are generally stated areas of interest that agencies in the federal government would like to see some innovative work. So they make a general statement and look to applicants to come in with good ideas. So I try to find one, maybe from the NIH, National Institutes of Health, or the CDC, Centers for Disease Control, or some other organization that's a part of the federal government that gives money to organizations for research. Then, over the course of the semester, I teach them not just how to think about consumer health informatics, but how to make a persuasive case, an argument, both to their own management and to a potential funding source. In other words, creating a funding application. This year, we have a new twist on the project. At this point, in the early days of the second administration, 5 months or so in, it is clear that funding for health information technology projects is either not available or it can't be relied upon, particularly for the full duration of what an innovation project might need to get to the point where it is sustainable on its own. To be clear, I'm not making a political argument. My goal is a more practical goal, to explore the implications of the administration's policy, as well as we understand it, from the perspective of health IT professionals. So, the first basic question we ask is, how do you make a convincing case to your management team that your particular consumer health informatics innovation is fundable and should be a top priority for your organization? Then the second question is, how will you fund your CHI innovation when the federal government eliminates or at best reduces funding not only for technology-based innovation, but even for basic healthcare research, not to mention the proposed decrease in funding for healthcare itself? I'm proud and excited by the work my students have done to answer these questions. As I've done on occasions in the past, I invited the students to collaborate with me as co-authors or as contributors to a paper that summarizes their project work. We wrote a paper titled, "Where Do You Go When the Government Shuts Off Funding for Your Brilliant Consumer Health IT Idea?" You can find it at this link at ResearchGate, which is a wonderful source for publishing research papers. This is a preprint, which means it hasn't been peer-reviewed and we haven't submitted it to any journal or publication yet. This video then is an introduction to that paper, trying to summarize the key points that we took away from it and hopefully encourage you to take a look at the full paper. When we engage in this kind of a project, the first thing we do is lay out through the course of the semester how you make a case for, how you prepare a funding application, how you prepare to pitch an idea to your own management team, perhaps. So we start, as you see here. Here are the 6 steps. I'm not going to linger on them. Again, you can read the paper for a longer discussion. This is the result of this semester's work. We had students come up with topics in 18 different areas. I find it just amazing. Some of these are areas where already technology is pretty well established, consumer health informatics, at least I think it is. Around diabetes, for example, there are a number of applications that help people manage diabetes. or diabetes-related health attributes. And yet my students came back and said, but there are things that are majorly missing that we could add to, that we could improve, that would help achieve the triple aim of improving health outcomes, lowering cost, improving the experience of healthcare, hopefully for both patients and for providers and clinicians. And so I picked 5 to feature in our paper. I picked mental health for adolescents. This refers to programs in schools and community centers rather than from a healthcare facility. I also looked at a wonderful project about tuberculosis and the management of tuberculosis in rural India, which is impacted by the U.S. ending funding for USAID. I certainly included the periodontal disease. And I included an interesting paper on young female cancer survivors' support groups, the guilt and the trauma they feel even when the cancer is in remission. Now, while this student focused on young female cancer survivors because that was her experience, I think the model is significant because, or the innovation and the need, the problem is valuable not only for young female cancer survivors, but beyond that. But for this purpose, I'm glad she narrowed it down because it lets us really hone in as we explore this important opportunity. And finally, I picked up the post-cancer diagnosis decision support project. So really interesting work. And if you are interested, you can read the paper where I put in a significant amount of the detail from each of these. Also, if you're interested in some of the others, let us know. I'll make introductions to the students. So let's look at some of the critical trends that are happening with respect to consumer health informatics. The first has to be the decrease in funding and the shift in sources, generally from the federal government to perhaps states, but given their pressures, we think more likely to non-governmental organizations, as we mentioned above. We certainly see a change in leadership with respect to priorities and requirements. Rather than the federal government taking the lead on as many of the federal requirements for health information technology, we see somewhat of a shift towards the private payers who will then be funding more of these applications and saying, what are the requirements and the conditions they want to put and associate with their money? Now, that isn't to say the federal government steps out of the business. For example, in the last several years, we've seen software applications qualifying for FDA approval under a program for software as a medical device. I think that's a tremendous opportunity. And I can't imagine that the federal government's not going to stay in that relationship. On the other hand, I'm not sure what the impact will be if their funding for the FDA is drastically cut and there is competition for where they put their scarce resources to evaluate and grant the appropriate certifications. So we think there's a change in leadership and in priorities, but we don't know quite how that will sift out over time. We certainly see, of course, advances in CHI technology, nothing greater than AI, and AI's advances aren't related to, of course, consumer health informatics. They are everywhere. And as with many such technologies that are still in the early stage of applicability, it remains to be seen how they will be applied, what benefits they will gain, and where that traction will come. The fourth trend that we see is the emergence of the patient or the consumer as their own health CEO. Now, this may be a new or perhaps even controversial kind of a notion for you, but if we look at the sum of all of the other changes and the impact on our culture and society broadly, the result is it takes us towards expecting that the consumer may well play a much greater role. Now, in the paper, we discuss this in a fair bit of detail. I draw a lot from a wonderful paper published by the consulting firm and the CPA firm Deloitte that was published in January of this year called The Dawn of a New Health CEO. And while I'd rather lure you to my paper to find this link, it's important enough that I'm going to give it to you right here. I'm also going to mention another health speaker, economist, Jane Sarasin-Khan, who was the one who, I should say in all fairness, through her posts, turned me on to the Dawn of the New Health CEO paper by Deloitte. So Jane Saracen Kahn is another person that I'd encourage you to follow. Finally, what are the conclusions? These challenging times require creative new skills from HIT professionals, and this is an example of some of that. The financial value proposition is elevated now compared to, for example, health outcomes, compared to improving the patient or the clinician experience. This isn't to say that those others are diminished or aren't present, but rather to say that if you're moving from a federal government kind of a source with its priorities to a private or private affiliated foundation, then the return on investment or the value, the financial sustainability of the innovation is elevated and becomes of greater importance, not superseding necessarily health outcomes or the experience of care, but certainly being elevated to a higher level with respect to those other two. AI is still in the very early stages, and I want to be clear that we've got a lot of room and a lot of opportunity. Several of our proposals focused on AI. I think we as academics have a wonderful opportunity in the next few years to be able to teach students really how to deploy AI, how to develop new models, how to train on new data sets, all while protecting security and privacy to achieve new benefits, tremendous opportunities. And of course, as we've said, HIT professionals must think globally, both to receive information and to proliferate their ideas. Finally, the age of the patient as their own health CEO is coming. Well, that's my 2 cents on it anyway. I agree with the folks at Deloitte. I agree with Jane Saracen Kahn. I don't know that it's going to happen in 6 or 7 years as Deloitte predicts, but I think we're within a decade. And what that means, we don't really know. But the good news is, here's our opportunity to shape it. And so I want to thank you for watching this, and I want to thank my co-authors and my contributors for helping to advance that idea, because ultimately it is a part of that idea of making a world where the patient is their own CEO of their healthcare. So finally, if you'd like to see the paper itself, you can go to this link on ResearchGate. The working title is "Where Do You Go When the Government Shuts Off Funding for Your Brilliant Consumer Health IT Idea?" With that, thank you very much. If you'd like to see some of my other posts, drop me a note. I'll make sure you know when I post the next one that will have something to do with technology and probably patient engagement and consumer empowerment. Goodbye.